Knock knock. Hello, my name is Brennan. I'm gonna be your nurse today. Can I get your name and date of birth?
Austin Barchinger, 10/10/97.
Okay, and then do you know where we are?
My house.
Okay, and do you know what we're going to do?
And that home health assessment.
Okay, and then do you know what the date is?
May 5th.
Okay, so patient is awake, alert, and orientated ×4. So first thing we're gonna check is your eyes. Oh, patient also has normal cephalic head, with trachea midline. So I'm gonna check your eyes. I'm gonna have you look at me, but looking through, kind of like you're looking through me, and I'm gonna shine a light in your eyes. Pupils appear to constrict. They're also round and equal on both sides at about 5 millimeters. Next, I'm gonna check your accommodation. So I'm gonna have you look at the tip of my pen light and just follow it with your eyes. Patient's eyes appear to converge. And the pen light comes in, and there's a brisk movement of the eyes. Then a nystagmus going back and forth. Next, I'm gonna check your mouth. Have you open your mouth for me. And do you have tonsils?
I do.
Okay, so I'll have you open your mouth for me. I'll have you go ah. So, patient's mouth, or tonsils are a 2+. Patient's mouth appears to be pink, moist, and intact with no open sores, lesions, or broken teeth at all. Lips are pink and moist and don't appear to have any sign of cyanosis going on. Okay, so next I'm going to check your lungs. I'll have you lift your shirt up for me. All right, and then any history of lung disease in the family?
Nope.
Okay. Okay. Okay, so every time I move my stethoscope, I'll have you take a deep breath in and out. Okay. Next, I'm gonna check your sides. Check your other side. The patient also appears to have an erect posture and appears to have no effort breathing. No signs of like labored breathing so far. check the back. Also gonna. Okay, so I'll put my hands together and have you take a deep breath in and out. Okay, so my thumbs come apart and come back in. So, patient appears to have breathing equally on both sides. As the thumbs move the same distance on both sides. Okay, so now I'm gonna check your back. So same thing, just every time I move the stethoscope, take a deep breath in and out. Air could be heard entering and leaving lungs. In good fashion. Okay. And then, now I'm gonna check your heart. Any history of heart disease in the family?
Heart attacks, yeah.
Heart attacks. Do you know what kind of heart disease at all?
No.
Oh, okay. What about high blood pressure? Does that run in the family at all?
I don't think so.
Okay, so I'm checking the aortic valve, right sternal border, second intercostal space. Now I'm checking the pulmonary valve, left sternal border, second intercostal space. Now I'm checking the Erb's point, third intercostal space, left sternal border. Now I'm checking the tricuspid valve, left sternal border, fourth intercostal space. Now I'm checking the mitral valve, mid-clavicular line. I'm gonna check the pickable heart rate for a minute. So pickable heart rate is at 72 beats per minute. S1 and S2 were heard. Okay, and now I'm gonna check your bowel. I'm gonna check your abdomen now. Oh, and so far I didn't see any like lesions, abscesses, bruising, or everything seemed that all the skin appeared to be pink and intact. Okay, and then for like bowel movements, how often do you have them?
I'd say twice a day.
Okay, and then do you have any trouble like having diarrhea or feeling nauseous?
No,
No.
nothing.
Okay. Okay, so then it's just solid, not like loose stool? Okay,
Yeah.
gotcha. And then for urinary, how often do you urinate?
Probably 3 times a day.
Okay, and then is there any like burning sensations, any pain?
No.
No.
Nope.
Okay. And then when you do urinate, what color is it?
Yellow.
Yellow, so like straw color. Okay. And is there any like odor to it? Like any strong odors?
No.
Nothing like that. Okay. All right.
Assuming you're talking.
So now I'm going to auscultate your abdomen. If we can lift your shirt up. Perfect. So I don't see any like striae, lesions, or abscesses, or any bumps, or anything. The skin appears to be intact and pink. So now I'm just gonna listen to your bowels here, starting in the right lower quadrant, listening to 2 different spots in every quadrant. So now I'm in the right upper quadrant. Okay, so I'm in the left upper quadrant. Left lower quadrant. Active vowel sounds were heard ×4. Patient also has a flat stomach and is a 1-to-2 ratio. And then he has an oval shape as well. And then now I'm gonna just palpate your stomach. Starting with a light palpation in the same order. So we'll start in the right lower quadrant. Now we're gonna move on to the right upper quadrant. Now we're gonna do the left upper quadrant. And then the left lower quadrant. Okay, and then now we're gonna do a deep palpation. Let me know if you have any pain. Starting in the right lower quadrant. And we're gonna check the right upper quadrant. The left upper quadrant. And then the left lower quadrant. Okay, so no unusual lumps or anything hard was felt. Everything seems to be soft and squishy, which is the way we want it. Okay, so now we'll move on to, I'm gonna listen or feel your pulses and then palpate your arms and legs. And do you have any history of like neurodegenerative disorders in the family? Anything
I don't
like
believe so.
Parkinson's disease, anything like that? No?
No, definitely not.
Okay, perfect. Alright, so I'm just gonna Feel your carotid artery. Then carotid artery feels there's a bounding pulse at 2+, equal bilaterally on both sides. So now I'm gonna just check your arms for edema. Skin is warm to the touch. No edema is felt so far. Skin appears to be pink and intact. I'm checking the brachial pulse. Both appear to be 2+, equal bilaterally on both sides. Okay, so now I'm gonna palpate, continue palpating. Still feels warm to the touch, no edema present or bruising, abscesses, none of that. Everything is pink and intact. Now I'm gonna check the radial pulses. Both appear to feel bounding at 2+, equal bilaterally on each side. Now I'm gonna check the hands. Checking capillary refills. Fingertips appear to be pink with less than 2 seconds on the capillary refills. Okay, so now I'm gonna check femoral arteries, which is around here. Okay, and then now I'm gonna continue palpating the legs, which is still warm to the touch. Everything appears pink and intact, without any abscesses or lesions present. And could I have you remove your socks for me? Okay. Alright, so now I'm gonna check the posterior tibial pulse, which appears to be at 2+, equal bilaterally on both sides. Okay. Now I'm going to check the dorsalis medius pulse, which appears to be 2+ equal bilaterally on both sides. Okay, and then now I'm gonna check your muscle strength, so I'll have you push up on my hands or your feet. Okay, and then I'll have you push down with your feet. Okay, I'll have you push me away, pull me in. So far, 5 out of 5 for strength on everything. And now I'll have you put your arms out like this, pull me in, push me away. Okay, so strength is 5 out of 5 for the arms. I think that's it.